Hey, happy Monday afternoon. Dr. Alan Christensen here with you. Welcome to another installment of Office Hours Live. So here's what's going on. We've got a recall taking place. A recall, no, it's a ban of a version of natural thyroid medication. So we'll talk about that today. Got a bunch of good questions sent in advance, and we'll get your ones that come in live as well. So welcome. This is Office Hours Live. If you've been here before, welcome back. If you're new, here's the thing. I'll cover some good questions about endocrine-related topics. Biggest single focus is thyroid disease, but also happy to cover weight loss, diet, things along those lines. And I'm trying to get all of my images lined up here. Here we go. Excuse me one second. Okay. Yeah, blood sugar related issues, diet, food, weight loss. So those are the big topics, all things related to natural endocrinology. All right, so welcome. And I'm watching the comments. I'm with you on a couple platforms. We're together on YouTube Live, on Facebook Live, and on Instagram. So let me know where you're from. It's always interesting to see that, especially at the very beginning. We see people from all over the world. I'm in northern Minnesota right now, and if you look at the backdrop, this is not a backdrop, it's the real thing. The leaves are changing. They're starting. We're going to get a good hard freeze probably in the next week or so. We had some frost already, but no real hard freezes. But if you stick around and show up on future weeks, you'll see these change a bit more and then disappear in the coming weeks. So yeah, well, it's fun to see the seasons change. Okay, so let me jump in and start talking a bit about the ban that's taking place. Let me just get to where I can see comments better too. Here we go. Now I can see them properly. Okay, so I'm seeing people jump on from Texas, from California, from Tennessee, from different parts of the country. We'll see a lot of folks internationally in most cases as well. So we'll see when they start to come on. But yeah, big news. We've had a ban take place. And this is compounded natural thyroid. So let me define that a bit for starters. What's compounded natural thyroid? Well, so compounded medication is a type that's made by a special compounding pharmacy. And this word itself created just a lot of misunderstandings. So compounded, this doesn't mean just natural thyroid medication. This is really specifically talking about those that are made up by hand. And I'm just taking a look around. We're seeing a lot more folks coming on. California, Berlin, Germany. That's cool. Vero Beach, Florida. Elsewhere, Idaho. Okay. And I'm seeing questions here about someone changing from compounded meds. So we'll talk about that as well. So for starters, what's compounded? Well, so compounded, the word is a contrast to legend or pre-made medications. So legend medications or manufactured medications are made by a factory. The machines crank out pills and they put set amounts of medication in the pills. And they're not always perfect, and we do see recalls that happen. Now, thyroid hormones and thyroid medications, they're a special case because the active ingredient is micrograms. A milligram is about like a grain of salt. I don't have one there, but you can imagine something about that size in your hand. And a microgram is 1,000th of that. So the quality control for thyroid medication is way up there. It's really tough to make it well. And manufactured, there's issues that can take place. There are recalls that occur. Now, natural thyroid and synthetic thyroid, I want to define these terms. They're not used consistently. When we talk about natural hormones, we talk about hormones being bioidentical, but we don't use those terms the same way when we talk about thyroid. Quick jump, we got a lot of folks from Utah, from South Africa as well. Calgary, it looks like. Turkey, this is pretty cool. And I'm seeing a couple doctors jump on, some names that look like they're doctors or medical people. So you guys probably get a lot of this, especially the whole thing about natural and synthetic. Those words make me nuts. So with hormone replacement like estrogen or testosterone, we say a hormone is natural when it's in the same chemical form that your body makes. It's bioidentical. It's chemically indistinguishable. But for thyroid medications, when we say natural, we mean that it came from a natural source. In the case of thyroid meds, that means it's just ground up pig thyroid. It's quite that simple. So pigs happen to make the same thyroid hormones that humans do in pretty similar proportions. So freeze-dried, ground up, desiccated pig thyroid is called natural thyroid. Now, the other products that are out are called synthetic, but in that natural hormone world, it's not the same meaning. So when a hormone like estrogen is synthetic, that means it's not the same as the body makes. When thyroid hormones are called synthetic, they're still the same. They're still bioidentical. So in that sense, they could be called natural. But anyway, the nomenclature is not consistent. So that's the natural synthetic distinction. Yeah, more and more docs are coming on. Good to see you guys. And hey, stay tuned, medical professionals. I'm doing a webinar for you all on how to individualize iodine for your patients, how to figure out who needs more, who needs less, when it can help, when it doesn't matter. And that's going to be coming up a week from this coming Thursday. And I'll post more details about that here, but this will be one in a series that I've been doing. So yeah, so the ban is about compounded natural thyroid. So natural thyroid means that it's pig-derived, it's a powder from a pig. Compounded means that it's custom made. So when a doctor writes a prescription, the pharmacy makes that potency for the patient. And the cool thing about compounded medication is just that. You can make it with fewer binders and fillers. You can make it at exact potencies. Sometimes the amount that's a good fit, one dose is too high and the next dose down is too low. But with compounding, you could go in between those things. You can do the exact amounts. So those are the things that are good about compounding. So the drawback about compounding is the quality control is simply lower. It's not the same automated process. Now, with thyroid hormones, remember we got the natural and we got the synthetic. So with natural thyroid, it's ground up pig thyroid. So the amount of mass, the amount of physical substance you're dealing with is larger because most of it is not active. A lot of it is inactive. Some of the inactive stuff might be good, might be quite useful, but anyway, there's more volume to it. So that's why we talk about natural thyroid in doses of like 65 or 120 milligrams. Whereas for synthetic thyroid like T4, we could talk about a potency in terms of 100 micrograms. Now, those milligrams of natural thyroid still contain only reasonable micrograms of active hormone, but there's more physical mass there. So when someone hand compounds a natural thyroid mixture, it's easier to do that well than it is to compound synthetic thyroid because the physical quantities are so different. Here's what I mean. Imagine that you're going to make a batch of 3 dozen poppy seed muffins. And so you stir in a quarter cup of poppy seeds to your whole batter. Well, does every muffin get exactly 253 poppy seeds? So the smaller they are, the less likely that is. Now, on the other hand, let's say that you're talking about muffins that have, I don't know, whole walnuts in them, just being silly, like a whole massive walnut. So you've got 36 walnuts for your batch. Well, if you had like 3 walnuts in one muffin, you would see that. That would be obvious. But if you had 200 poppy seeds versus 50 poppy seeds, that might not be obvious. So the smaller things are, the harder they are to compound. So honestly, natural thyroid medication compounding is more of a reasonable consideration. But for synthetic thyroid medication, it's trickier to compound. So this ban is to compounded natural thyroid. Now that's not NP thyroid, that's not Armour thyroid, that's not Nature thyroid, that's not WP thyroid. Those are all manufactured versions of natural thyroid. So this is just a compounded. So people have asked why the ban has happened. Well, I can't think of any positive reasons for it in all honesty. There are a lot of issues that occur with compounded synthetic thyroid. There are some that occur with compounded natural. But at the same time, there's a lot of people that do much better using compounded natural thyroid. They don't have other options that work as well for them. So the idea of banning it based upon complaints, I would argue perhaps there's ways in which it could be better regulated or more closely monitored or more quality assurance steps put in place. That's all fine. I could get behind that. But I can't really justify a ban. And the wording of the ban talks about a new categorization. So one of the ingredients in natural thyroid is called thyroglobulin. And it's not added in, it's just there. But that was newly categorized into a group of medicines that simply cannot be legally compounded. So the FDA kind of just made up it moved something into a category that it wasn't in before. And then it banned it because it's now in that category. So it seems like a pretty obvious, transparent move to restrict the usage of this class of medication. So the ban, as it was written, was pretty equivocal, saying this is it, it's over, done deal. Now, pharmacies are still dispensing what they've got, but they cannot get new raw material. So this may turn into a shortage. But there are some fights against this ban that are just now getting going. And they may be successful. They may not. We don't know. But right now, that's the status of it. So I've got a lot of good questions that have come in before. I'll talk about those. I'll talk about some of the questions that have come in as well. Let me just take a peek for a few of the ones that have comments and questions about this topic for starters. Here's a good one from my dear friend Joanne. How soon for WP being available again? I thought it was gone for good. Joanne, I did too. I did some that's funny, some deep digging and got on the phone when I heard about this ban and talked to a lot of friends I have in industry. And what I learned is WP and Synthroid are not gone for good. In terms of exactly when they're coming back, we don't have a hard time frame, but I'm pretty optimistic about them being available soon enough to be pretty helpful if this ban does end up going through. So that's really exciting news. If you don't know already, you guys, so WP thyroid is basically a clean version of natural thyroid that doesn't have binders or fillers, but it is manufactured. So we get the good quality control benefits of manufactured over compounded. So there we got that. Lots of folks coming on from Germany, from elsewhere around the world. So welcome, welcome, welcome from Sweden, more from South Africa. So I'm looking for a few questions related to the whole ban, and I'll jump on those, more from Northern California. And then I'll grab a few of the questions that were sent in, and then I'm happy to get other questions that came in on just other topics. So speaking of which, Lori has a related one. How often, let me just change my screens out here. How often should labs be done when switching from compounded T3, T4 to Terracent? So yeah, changing medications in general, I like to have someone retested at least within a month. So here's my hesitation with this one, Lori. I'd like to test even sooner, but whoever's testing has to be able to take into account the fact that your labs don't reach level state until about 3 months. So one approach is to test no sooner than 3 months and get a really accurate reading. That's cool. The accurate reading is important. However, it's pretty common that someone needs a couple of dose adjustments after they change medications. And in the big scheme of things, when you go to retest, your doctor's office will send the lab order in. You've got to then call to schedule. You get your results. You schedule a follow-up. So a 3-month test, the whole thing might take you 3, 4, 5 months to get the whole thing done, start to finish. And if you do that several times, it can be a year before you get a couple of easy adjustments made. So that's why I like to test sooner. And I've trained the integrative health doctors. We can check at 2 to 3 week intervals. It just takes doing some math on how soon you had tested, where your scores are, but you can take the scores at face value. So that's the big thing there. You've got to know that if you're testing sooner than 3 months, you can't just take the scores for what they say. You've got to be able to anticipate where they're heading in the coming, however long it is, before 3 months when you test early. So that's the answer. If you want perfectly accurate tests, wait 3 months. If you want to test sooner and get dialed in more quickly, you can, but it takes reading the labs with some finesse and with a little bit of extra training. So there's that. Can you use, so related ones again, can you use a bioidentical thyroid hormone instead of Lebothyroxine or Synthroid? So yeah, so Lebothyroxine, which is a generic name of Synthroid, it is bioidentical. It is bioidentical. And if we use the nomenclature we use for hormone replacement, we would call that a natural hormone, but we're not consistent in our nomenclature. So this is not me saying that Synthroid is the best medicine for everyone. I'm not saying that. But if your only concern about it is that it's synthetic, Well, it's synthetic in the way that vitamin C and vitamin B in your vitamins are synthetic, and they all are. Some will say natural vitamins. Yeah, minerals can be, fat-soluble vitamins can be, water-soluble vitamins are not. They are synthesized. Now, they're synthesized in this to the same molecule that they're found in foods. So you couldn't chemically tell them apart by any known process, but they are made in the laboratory. So in that sense, yep, Synthroid is as natural as vitamin C is. But many people do better on different medicines. So yeah, your question, just know that it's not, it is bioidentical. It is the same thing your body does make. Now, your body makes more than that. Your body makes other hormones, and it makes other compounds as well that are probably active and useful, but it is the same thing. I'm seeing a comment here. In Turkey, it is impossible to access natural thyroid. You know, there are differences from country to country. And I know some countries can import from others. I have no idea about the regulations in Turkey. I apologize about that. But I do hear some say that in the EU, they can import from other countries. So I don't know if that's an option. I've also heard some in the EU will travel to adjacent countries for filling prescriptions if they can't get the exact one in their country. So I don't know if that's helpful or not, but there are restrictions that are different in some places more than others. Joanne, I do best on WP. I see that. I hear many say that. Related comments. I take compounded natural, hoping and praying this is overturned because changing meds is always difficult. I would like more info on WP and possible benefits over natural compounded. Thank you. Hannah, totally with you. It's never easy to change medicines, and it often does take a few adjustments. Changing from compounded when it's done well to other brands of natural thyroid, probably the easiest change. Changing from categories of medication, like going from Synthroid to natural or vice versa, that's a complicated change and not easy. It does take a lot of different steps that way. So some WP versus compounded. So Hannah, when compounded is done well, there are pharmacies that do assay active ingredients before and after compounding. They all don't. I wish they all did. I wish it was done by a third party. They all don't, but some do, and some do a good job at that. Now, compounders also can use different amounts and types of binders and fillers. A generalization is that they can use fewer. One of my favorite compounded mixtures is baking soda or sodium bicarbonate. They can use that as a base to add the natural thyroid powder. So that is an option for compounders. When it's made with baking soda and when it's well assayed, I would argue that it's as good as WP thyroid. WP thyroid, the inactive ingredients are inulin and medium chain triglycerides. So artichoke and coconut extracts, no other inactive ingredients. And there is good quality control in the manufacturing process. So that's why I like it, but pretty comparable with well-made compounded. But again, compounding, the one concern I have is that it's up to the individuals. So kind of like a recipe, you know, a recipe can be made by a chef or someone who doesn't cook a lot, and it's the same recipe, but it's not the same thing. So if you know that there's going to be a certain chef making your recipe and you always get it there, that's cool. You can be good with that. But compounding, it's not always the same from place to place. And that's why I prefer manufactured when possible, when it's an option. Okay, related questions. Okay, I love this one from Kathy. This makes such a good case for deprescribing. Kathy, thank you so much for that. Hallelujah. I couldn't agree more. This makes such a good case for deprescribing so you don't have to panic when your meds aren't available. I have cut down considerably once I heard about it from Dr. C with the goal of getting off completely. Kathy, yeah. Couldn't agree more. And I think that there are many cases to where getting the medicine just right is helpful, but the broader perspective, I would completely echo your comments. The broader perspective is, how cool would it be if you didn't need the medicines altogether, or if your body was healthy enough to where most any type at a reasonable dosage would work fine. Here's the thing, when your thyroid and your liver and your kidneys all work well together, you don't get the exact amount of thyroid hormone every day. Your body has massive amounts of latitude for adjusting it and fine-tuning it. And there are cases where you need just the right amount because none of the things are working well. But when they work better, you get more leeway on that. So part of the thought is, by all means, do what works, do what's helpful right now in the moment, and think through steps you can take to help make your body more resilient and have more leeway and be more flexible about what comes into it and what it's making by itself. So yeah, thank you for that, Kathy. That's what the thyroid reset diet is all about. And that's what judicious deprescribing is all about. There are ways that people who are on medication that have a thyroid can almost always do well on less, and in many cases, none. That's possible for so many more people than you would ever imagine. Also, take a peek at thyroid-specific formulations. But yeah, the big three things are the right micronutrients, thyroid-specific formulations, the right level of iodine, so the thyroid reset diet, and then some good guidance for deprescribing along the way. So for a related question, I just saw one from Leaf A. I wish you could treat people in Pennsylvania. So there's different kinds of treating people. So there's like working one-on-one as a prescriber, and then there's working as an advisor. So as an advisor, I can give feedback to your prescriber, to your medical team. And that is an option if you're in Pennsylvania or in Germany or South Africa or wherever you are. The location doesn't matter. We can work directly live in person, and I can give guidance in those ways that can be useful. And that's at thyroidopinion.com. I'm just dropping that in. And I'm taking a peek here at a couple different platforms. Thyroid opinion. Opinion? I didn't spell that right. Opinion. I can't spell very well. .com. Yeah, there we go. You think they'd get offended? So the question is, would your prescriber be offended about getting input? I've not had that happen. It's certainly possible, of course, but I've had many examples where prescribers are happy to have some input and guidance. I think most really are well-intentioned, well-meaning, and eager to do better and eager to get some assistance and some guidance on that. So I think there's a lot of ways that they could be if they were approached about it badly, but I think that I've figured out good ways to communicate the input and the suggestions that are gentle and not authoritarian and not taking over, but just some helpful input. And not saying that it can't go wrong or that I can communicate perfectly to everyone, but no, it generally does go quite well. The doctors you give feedback to, yep, totally got that. Yes, and that's available. Okay, so I think I covered the bases on the whole thing about the ban, and I'm seeing just some more new questions come in, and I'll grab some of these new ones here as well. One of the new ones that came in was one that I was planning on covering already, so I'm going to grab that one. This was from Cynthia. Cynthia sent a message earlier about quitting smoking. Can you address this? Cynthia, I sure can, and I've got your question right here handy. I just got to change screens real quick. I think that was right here. There it is. So Cynthia was asking about quitting smoking. And this might surprise some people, but those who smoke and quit can have short-term negative changes to their thyroid function. And Cynthia has become aware of that. She mentioned about increase in antibodies, changes in T3, T4 levels, possible negative stuff. So Cynthia, totally true. Now, the good news is these changes are only negative in the short term. So if your head's not spinning now, you're not paying attention. Smoking actually improves some markers of thyroid function. It does. So it worsens some markers of hyperthyroidism, but it improves some markers of Hashimoto's and hypo in the short term. Why would that happen? Well, thiocyanate, which is a compound in tobacco smoke, actually slows the activity of thyroid peroxidase. And because of that, it changes the distribution of T3 and T4, and it artificially lowers the enzyme's TPO because there's less TPO present. So in the big sense of things, Cynthia, when you come off of smoking, your thyroid's not going to crash. No worries about that. The ways that it changes your markers are not really making you healthier. They're just ways that it changes lab chemistry on paper short term. So what you're doing is the single most powerful thing you can do to improve your health. I completely applaud you, but please know that, yes, your thyroid markers may change a little bit in the short term, but in most cases, the clinical relevance is only positive. So you're only going to move your health in the right direction by doing so. So please don't stress about that. Okay, let me do a couple more that were sent in advance also. Here's a few of those. Let me just remove Cynthia's comment. Yeah, here was a quick one. Taking Armour for 10 years. My family doctor says I'm negative for Hashimoto. Should I wean myself off of it? Endocrinologist says I have Hashimoto's. Family doctor says I don't. Yeah, so Hashimoto's diagnosis is not based solely on thyroid antibodies. I'm guessing the family doctor measured the antibodies, saw they were negative, and is saying you don't have Hashimoto's. So the separate question is, do you need the Armour long term? Please take a peek at my articles on de-prescribing. Let me just find one of those to share that link with you guys. Here we go. Most folks on thyroid medication can take less, and many can take none, and you're healthier by doing so. Your body's better off making more of it by yourself. So I'm dropping that link into Instagram and these chats. So there we go. And another one, relationship between T3 uptake, estrogen dominance, worth testing. No, per se, it's not, but it does make a big difference on when you test in your cycle. So thank you for asking that one. So testing in your menstrual cycle, I wish that more doctors would talk about this, because it happens a lot that people repeat their thyroid test, their scores are different, and why are their scores different? Why did that go up? Why did that go down? And in so many cases, they went up or down for reasons that are not relevant. They're just because you're comparing different things at different times. Like, imagine you compared someone's height when they're sitting down. You measured their height. Okay, so right now you can measure my height. I'm probably about, my head from the floor is probably about 3 feet, maybe a little more than 3 feet. So if you measure me at my height sitting down, and now tomorrow you measure my height again, well, this time I'm going to be standing up, okay? So now if I stand up really straight, my head to the floor is just about 6 feet if I stretch and use good posture. So 3 feet versus 3.5 feet. How in the heck were those heights so different from one day to the next? Well, you didn't say, do it standing up both times. And that's ridiculous. But that's honestly as big of a deal as it is when you check your thyroid levels. And if you check them mid-cycle, or if you check them during your period, you're checking your height standing up one day and then sitting down the next day. And you're going to get completely different numbers, but you didn't necessarily get taller or shorter. It was just different circumstances. So great question. You want to measure your thyroid the first 9 days of your cycle or the last 9 days of your cycle, but not the middle of your cycle, not days 10 through 20. So yeah, easier way to think of it, the first week right when your period starts, or the week right before your period. If you know when your period is, that's simple. If you don't, wait until you get one and then measure your thyroid in those next few days. Those are the times in which the binding proteins are low and you'll get consistent readings. If you measure other times in your cycle, you don't know what you're going to get. And you can't compare it accurately because you'll get totally different numbers. So yeah, good question. So related questions that we've talked about already. Is it possible for someone who was told by a parathyroid surgeon that her thyroid looks like Swiss cheese to de-prescribe? I've been on thyroid meds for 4 years. Lori, it is. So those who can and cannot successfully de-prescribe, there are certain criteria. I talk about those in that article, but the Swiss cheese appearance, that's also called heterogeneity. That's a common sign of one of the more typical variants of Hashimoto's. That's not one of the things that indicates someone cannot de-prescribe. And de-prescribe, I should say, means lower or eliminate. It doesn't only mean eliminate, it means lower or eliminate. But that doesn't change your odds of success. No. The article does talk about which things are most predictive of success, so check that out and get some more sense out of that. Let's see. How long after quitting smoking should I have labs done? Cynthia, yeah, great question to follow up on that one. I wouldn't even worry about timing it relative to quitting smoking. Time it to when you're due for it anyway. Think about when you were due for a retest anyway. Quit smoking ASAP and test as soon as you were due for it anyway. The results and the changes to your thyroid labs won't be very consequential, so don't stress about that too much. Cynthia, I'm glad you asked again, because something else that I want to just suggest to you or anyone else who quit smoking. This is a really cool tip that I don't hear very often, but I think is really practical. So when you smoke, that changes how your liver clears caffeine. Cynthia, let me know if you use caffeine or not. Most people do. Most adults have coffee or tea or some combination of that, and that's fine. But what happens is smokers clear caffeine faster than non-smokers, like 3 times faster. So a lot of people, they quit smoking, and now their livers are more like non-smokers' livers when it comes to caffeine clearance. So if you think this through, that means your caffeine dose just tripled as far as how it feels in your body. And a lot of the symptoms of tobacco withdrawal are anxiousness, jitteriness, insomnia, agitation. Think about the symptoms you would have if you tripled your caffeine intake. You'd have a lot of those same symptoms. So if Jane Doe, just making up a name, if Jane Doe smokes and Jane Doe drinks 2 cups of coffee a day, every day, and now Jane Doe quit smoking, suddenly it's as if Jane is now drinking 6 cups of coffee per day, even though she's not. And so she could feel a whole lot of symptoms from that extra caffeine that have nothing to do with stopping smoking. But in her mind, she thinks, oh, I feel all jittery and crazy because I quit smoking. And maybe she slips, maybe she smokes again, and all those things go away. Well, a lot of it could have been the caffeine. I wish more people were told about this. But when you quit smoking, you want to either stop caffeine or take your intake down by a factor of 3. So if you have 3 cups, go to 1. If you have 1 cup, go to a little cup or go to decaf. But if you don't do that, the effective caffeine in your body will basically triple when you quit smoking. And that can go a long ways towards cutting your odds of being successful. So please know that. That can make a huge difference on your likelihood of doing well with stopping. Related question about testing. I hear we should take thyroid med day of lab testing too. Is that true? Leaf, a great question. So what we're talking about here is a peak and a trough. When you take a medication, there's a certain time frame at which the blood levels are at their all-time highest. That's called the peak. And then there's before you take it, when you're at your all-time lowest, that's called the trough. Thyroid labs, their normal range for T3 and T4 are set at the trough level, at that lowest level of the 24-hour cycle. They're not out of your body completely after 24 hours. They're still there, but they're at the trough. The tough thing about thyroid meds and a peak reading is there's not a peak reading. The peak is somewhere between 2 to 10 hours, and you never know when from day to day, from person to person. So you can't say it's exactly here. So trough readings are preferred, and that's before you've taken your medication. So the protocol there is the day of your tests, do your tests as early as you can in the morning. That's also more accurate for other reasons relative to your body's circadian cycles. Do your test first, then take your medicine afterwards on that day. Other days you could take it earlier, but the day of your test, take it after your labs are drawn. Otherwise, you'll get really goofy numbers for T3 and T4 if your medicines contain either of those. So yeah. Let's see. Another related one, I'll get a couple more back and forth, but let me just follow up with this one. TPO is at 56. Does that mean my thyroid issue is less than the autoimmune and more about thyroid resistance, as I've heard from my last integrative doctor? Thyroid resistance, Leaf, is something that I think is a bit overdone. It's a real phenomenon, but it's quite rare. The body can resist thyroid hormone when there's too much iodine, but in most cases when someone talks about thyroid resistance, what they mean is a lower TSH and then a low normal T3 or T4. And that's not thyroid resistance. That's just the body getting rid of hormone when they're being given too much. It's a normal response. So yeah, the thyroid resistance thing is, I think, overdone. And kind of misinterpreted. Okay, let me jump over back to the YouTube and Facebook comments here and look at a few of these. I saw someone new here. Just got the book, started to follow the recipes. Yeah, thank you for that. Hope you enjoy those. And I'm guessing you're referring to the most recent book, but I could be wrong, the Thyroid Reset Diet. The next book is going to be all recipes. So hope you guys enjoy that. I'll make some more announcements about it, but looking like March, this coming March, for the cookbook to come out. I'm really jazzed about it. I've been slaving in a hot kitchen for years for this. That's the old saying, right? But I've had fun with it, and I'm really excited to share it with you guys. Corey's got a question, and Corey, either you sent one in advance or someone sent in the exact same question in advance. Can iodine drive TSH up? Heck yeah, it sure can. And by driving TSH up, it's actually causing hypothyroidism. It can also drive autoimmune thyroid disease. When do we know if we need it? If iodine urine tests shows high. But now my TSH is high and I can't lose 12 pounds despite diet exercise. Not a medication. We can do this naturally. Corey, yeah, great question. I'm glad you're here. The short answer is, in almost all scenarios, you can have too much or too little iodine. But since 1980, we've had 7 documented cases of iodine deficiency in the United States. 7 cases. Now, meanwhile, about 30 to 40% of adult women are at risk for thyroid disease from too much iodine just in their diet, not even thinking yet about iodine supplements or iodine found in other supplements. So the odds of too much are like here, and the odds of too little are like there. It's something like that. Urinary iodine tests are not super meaningful. If your test shows high, however, you can take that at face value. You're probably too high in iodine. Please, Corey, take a peek at the Thyroid Reset Diet. You can Google my name in that as well. But the book is there. There's a lot of free resources online. But I explain how, for most of abnormal thyroid function, lowering iodine has a good chance of reversing your problems. So yeah, please check that out. And you have a really good chance of being able to do this naturally. One paper showed those that had severe thyroid disease, they could reverse that 80% of the time just by changing their dietary iodine. So pretty consistently helpful. And the 80%, I got to say this, the 20% that didn't get better, almost all of them didn't really follow it very well. And then another chunk of them got better, but not all the way there just yet within the time frame of the study. So somewhere around 95 to 97% of people can radically improve their thyroid function if they follow those guidelines. So yeah, super helpful and very consistently effective. All right, Dr. C with you guys, Office Hours Live. We're rocking along. Lots of great questions have come in. Let me grab a couple more. I have taken L-Thyroxine 88 for years, and in this last year, my breasts are always tender. My TSH results were high, and my house doctors prescribed 100 milligrams. The tenderness is very uncomfortable. Could it get worse with a higher dose? So Anna, a couple thoughts. I'm OCD about milligrams and micrograms because I've seen doctors make the mistake. You making the mistake is totally harmless, but it's 100 micrograms. It's 1,000 times smaller. So I can't not say that because I'm OCD about it. Breast tenderness and hypothyroidism, they can be related. If your TSH results were very high, that does mean you're moving to a hypothyroid state. And many things can be related to breast tenderness. This could be one of them. It may or may not be the one factor that's causing it, however. So the other question is, if you were stable, I have taken this for, so I'm reading into what you're saying. I may or may not be correct, but I'm reading into what you're saying that you were stable on this medicine dose of 88 micrograms for a long time, and suddenly you are not. So the other question is, why would that happen? Why would you do well on this dosage and have that change? The issues we think about there are taking it consistently, and then also about iodine getting into your system. So same thing, this can be a big factor that way. But it's important to know why your needs changed. It can also be a matter of absorbing it poorly. So you would want to adjust the medication with your doctor's guidance, but you'd also want to know why you would need to. And as always, dig deep to the cause. And as Kathy mentioned earlier, also consider deprescribing. Most people on thyroid medication really weren't candidates to need it long term. And the point about this that I really want to just hit home is that The main reasons people put on medication are reasons that medication usually does not help. So medications can always change thyroid levels. Medications can pretty much always give someone normal thyroid levels, but that doesn't mean that it takes away their symptoms from being hypothyroid, and it doesn't mean it cuts their risks from being hypothyroid. That's not intuitive. If someone has hypothyroid blood levels, they have symptoms, they're tired, they gain weight, they lose hair, they feel awful, they're real, they're a big deal, and they have health risks from that. It would seem so logical to think that if you change those levels of medication, that you would change those problems with being hypothyroid. And in some rare cases, you can, but in nearly all cases, you cannot. So for so long, people have thought, why is the medication not helping? Is it the wrong one? Is it the wrong type? It's the wrong approach. We have clear data that medications do not help nearly all thyroid symptoms and nearly all complications from thyroid disease for the most common diagnoses that the medications are given for. And I talk about that a bit in the deprescribing article as well. So for most people, it's not that they're on the wrong pill or the wrong amount or that they need to get the compounded or the non-compounded. It was a fool's errand to begin with. Nearly everyone was prescribed thyroid because their TSH was high normal or high above range, but they weren't yet shutting down. Their thyroid wasn't shutting off, thank goodness. But in those cases, the medicines can improve the scores. They will, but they don't improve the symptoms for most people. They just won't. So what will? Reversing it naturally, reversing it through dietary change. And that works for nearly everyone much more consistently than medications can help. So that's why I'm just so happy to share and that there's better solutions available. All right, that was a pretty long rant. Follow-up comments and questions, we jump on these. Here's one. Here's a great one. Let me see if I can just. Okay, I'm just doing a quick direct reply. I just did a direct reply there. So Ash is asking, how important is it for my MD to test thyroid antibodies after thyrotoxicosis? It's been 2 years. He says I'm euthyroid or maybe subclinical hypothyroid, but dismissive of looking at my antibodies. Ash, so this is a great question. Another big platform I like to push is this one. So thyroid antibodies, they can cause symptoms even if you are euthyroid. And for many people, they can be the biggest driver of the symptoms. I'm going to share a link here for you. I talk a bit more about this. So under this antibody support, I talk a little more about how thyroid antibodies can affect symptoms. I'm sharing this link here. And the data is clear that even when thyroid levels are normal, antibodies can cause fatigue, poor quality of life, hair loss, infertility, cardiovascular risk, and other complications. So, also the last one that showed up, recent study, thyroid antibodies in a pregnant mom can cause a higher risk of autism in the baby with when the mom has normal thyroid blood levels. So the antibodies are a big deal. And if you're feeling great, it may not be as relevant, but if there's any problems or health risks, the antibodies can drive that. So they are essential to test and to be aware of and not to ignore. So yeah, great question, Ash. Check that out. I talk a bit more about that on that page. And I've got a lot of other free data on thyroid antibodies you can find all over the web. So please look into that for some options. Okay. Shelley, I had a child with autism. I am sorry to hear that. I don't know if your thyroid function is relevant to that at all, but there's new data saying that this is a risk. Thyroid antibodies are a big deal. They do affect your health in a lot of ways, and they may affect your baby's health as well. We now have evidence saying that. So it's totally critical to make sense out of antibodies and control them effectively. Great one. Danita, can you reverse thyroid condition if your thyroid removed? I felt best on Nature Thyroid, but it's off the market. Danita, if you have no thyroid, you would need long-term replacement in some way. Nature Thyroid may be coming back. I hope so, as will WP in the coming short term. Hopeful for that. Let's see. Another one from Danita. Having hair loss based on labs that it could be my iodine and iron levels, candida, and stress. Can thyroid cause it too? I had to get meds adjusted. TSH was too low. Danita, thyroid meds can cause that when there's too much or too little. When your TSH is too low, you're getting too much. Now your iodine, when your doctor's testing it, I'm sorry to be blunt, but it means they don't understand it very well, because the iodine tests for people are simply not accurate. They're accurate for groups of people, but they're just not accurate for individuals. So yeah, we don't base decisions off of those. Iron, however, is a big, big factor with hair loss. So it can be very relevant. So the fact that you were on too much thyroid, that could have been a big part of the hair loss, but your iron could be a factor as well. And I'm going to share a link to an article that I've written about a lot of details on iron. I've got a few on hair as well, but I'm going to share this one about iron because it's just most relevant to your question there. But yeah, it can be a big driver of that. Okay. Lots of good questions, you guys. I'm just kind of picking around here. I want to get one or two more. Oh, yeah. I can't ignore this one. So question on iodine level was low end at 59. Took pure encapsulations, potassium iodide supplement for 1 year. Level is lower at 40. Absorption issue, wrong type, kelp. Travel Queen, yes, I hope you're still here. So for starters, tell me what kind of an iodine test that you had done. If this was a blood test or a urine test. Please give me that feedback, Travel Queen, about your iodine test. I hope you're still with me on Instagram, and I will give you a more direct response about that. The short version is that iodine tests are not accurate. They do show high, low, medium levels, but they're not reproducible. You get different numbers if you test again, even once. You have to do, I have some numbers top of mind. I just made some slides about this. If you do 2 tests that are accurate types of tests to begin with. Oh, it was a blood test. Awesome. I was hoping to hear about that. Travel Queen. Okay, so what I was about to say now doesn't even apply to you. So if you do 2 urine tests, you're within about 50% accuracy if you average them. If you do 4 tests, you're down to about I think it was 40% accuracy. So if you want to be within 5% accuracy, you need to do literally hundreds of tests. Now, blood tests, Travel Queen, blood iodine tests, everyone, they have no relationship whatsoever with the iodine in your thyroid or the iodine elsewhere in your body. They only relate to iodine toxicology. So what does that mean? Well, iodine can have nutritional ranges and toxicologic ranges. So toxicologic ranges are the ranges that emerge when your kidneys can't clear any more iodine. So when that happens, your blood levels start to go up. Before that happens, the amount of iodine in your blood has no relationship whatsoever with your nutritional status of iodine, none whatsoever. Only when your kidneys are failing or there's so much massive iodine they can't clear them, that's when it elevates. So the reason that blood iodine levels exist is to test people who are at toxicologic levels of iodine. Who's that? That's people taking massive doses from a medication called amiodarone or from iodine contrast agents. The amount of iodine in every other form doesn't register on blood tests. And those tests can show high iodine even months after exposure. But yeah, blood iodine has no purpose whatsoever to test someone and say, oh, this blood level is low, you need more iodine. That's a complete misuse of a blood iodine test. It's only needed after amiodarone or after iodine contrast. Just no relationship. I can't emphasize that strongly enough. Yeah. Let's see. Longing for the Pacific. I'm using the plus sign and then the question on Instagram for my question, which is posted at the beginning of your post. Just check and see where you're pulling the question from. You know, longing for the Pacific, I think you're more advanced than I am. My current setup, I can see questions and comments, but I can't see questions from what you're describing. My apologies. I've got a setup that allows me to be on both these platforms, but I can't see my phone. I can't see that side of my phone. So if you wouldn't mind sharing your question in your comments, I will keep an eye out for that, and I will give it special attention because I missed one you put up already, and that makes me feel bad. So thank you for bringing it down to my level and repeating it in a way that I saw it. Sorry for missing it. Please drop it into the comments here I'll hang out and watch for it. Okay, ideas on LDN. Let me just share a link with you directly. Actually, no, I'm just going to go to PubMed and share the actual citation because that's easy to get as well. And let me preface this by, oh, here's a new one now. We got another one. Oh, yep. Okay, this is one that I have seen before. All right, I'm going to share this link here for you right here. Now, I think hard about how to best answer questions and how to best not just answer your questions right now in real time, but I mean how to sort out different ideas and different opinions and conflicting data. I put a lot of thought into how to sort things out, how to best come to conclusions. There's a science about this. It's called epistemology, and that was one of my focuses in my undergraduate work. It's the science of knowledge. Like, how do we know what we know? How do we know what's accurate and what's not? And I think hard about this. So when people ask about something like, does LDN work? A lot of folks have taken LDN and said that it's worked for them. That's cool. A lot of folks can give reasons, very complicated, very compelling reasons why they think LDN would work. That's cool. So, however, sometimes people have antibodies go up or down anyway. A bizarre thing I've talked about is the blue sock treatment. So somewhere around a quarter of people will spontaneously have their antibody levels go down. That's cool. If 1,000 people decide that, are told that blue socks will lower their antibodies, right? If 24% of them are going to go down, that means over 200 people will have their antibodies go down because they're wearing blue socks out of this group of 1,000. Now, we know that's silly, and we know that the blue socks didn't help their antibodies. We know it's just a random coincidence. But I wouldn't want to mistakenly tell someone blue socks will help you. Maybe they'll be lucky, maybe they'll get a coincidence like that, but I want to know for sure that they worked. So when I think about LDN or a lot of the treatments, I want to know not just was that lucky or was that random, but is that like a real phenomenon? So what people say is that LDN will lower antibodies and cause people to need less medication. Now, I'm all for both of those goals. I want people to need less medication. I want them to have lower antibodies. But I also want to know if LDN works or if that's blue socks or if that's just a random coincidence. So a really good study was done in which they gave a group of 800 people that were on thyroid meds. Some were given LDN and some were not. And quite simply, they were tracked to see who needed more medication reductions, the group on LDN or the group not on LDN. The group on LDN actually needed more medication increases than the group not on LDN. They didn't need more reductions. They had fewer reductions. They had more increases. Now, the number of additional increases was such to where that could have been random. So I wouldn't say from that study that LDN definitely made their thyroid function worse. However, I can say it definitely did not make their thyroid function better. So far, it seems like LDN didn't have any special effects. And a few more of the ways I think about this are, is LDN something that our bodies naturally need? Is a lack of LDN why thyroid disease comes about? No. So we're not treating the cause. Is LDN perfectly safe? Some people get seizures from low-dose naltrexone. Not commonly. This is not like a common issue, but it does happen. So I really want to think through if a treatment is not perfectly safe, if it's not treating the cause, I'd want really good evidence before I would prescribe that to you or anyone else. I'd want to know for sure that this is the best option, it's consistently helpful, and it's not working by random chance. So that's my thought process, and I shared a link about the study that I talked about on LDN. Bridget, blue socks equal intention. The power of words or intention, placebo effect. I healed my body from Hashimoto's as possible. Bridget, I would go even further than that. So blue socks, yes, there are placebo effects, but there's even effects that occur when people aren't expecting there to be a change that happens. So the placebo effect is even bigger than that. So when we look at what happens, for example, if someone's in a clinical trial in which researchers have words of encouragement, or they give positive expectations, or they give reasons why something should work, then that blue socks thing goes from 24% to like 50%. And so the difference between that is what you're talking about is or intention. And now part of it is intention. Part of it is we believe things happen that we believe will happen. Part of it is our mind does help our body. I totally buy into that. That's true. But part of it is also, part of placebo effects are random changes. Part of them are just random regressions as well. So there's a lot of things that go into the placebo, including intention. But these are real things. And if that's why something is working, that's cool. Let's do hypnotherapy. Let's do visualization. Let's do guided imagery. Let's say affirmations. Those are real. Those are powerful. But let's know them for what they are. And if a pill is working by a placebo, let's know that. Let's say, no, let's just do the placebo better. Let's use that effect and harness it and use it to its fullest potential. But if a pill has side effects and it only works to a placebo, I'm not a fan. I want to know that. So I want to know those distinctions for you guys. Okay. Ideal T4 and TSH levels. Yeah, great question, Tristan. So they vary a lot based upon age, gender, pregnancy status, lots of things like that. So I'm going to share a link about optimal thyroid levels, and it will help you. Yep, here we go. This will help you take a peek at this and figure out the best ones for you personally. Here's a detailed blog I wrote about best thyroid levels for you. Check that out and enjoy. Okay. Kind of winding down in terms of timing here, you guys. Kathy, I love that you don't avoid questions that might seem counter. Thank you for that, Kathy. Funny thing is, I get chewed out often for saying things that are counter, that are different from what other people say in natural medicine. So I love being thanked for that. If people say what you expect them to say, if there's a formula in communication to where if what you're hearing is exactly what you would expect to hear, there's not much information in that. So I don't say things that are counter to be contrarian. And in many cases, like for example, natural thyroid, I'm a big fan. I think it's very helpful for a lot of people. That's true. That's the same thing that many will say in natural medicine. And that's counter to what many will say in conventional medicine. But I do my best to call them as I see them. I do my best to look at the data, look at the best evidence, and not really line up with this party or that party, but just figure out what's best for you. And what's the closest, what's the least wrong, what's the closest to accurate, what's most likely to be helpful. I'm just trying to do my best to be accurate. Opinion on statins. I saw that a couple times, Shelley. I don't have strong opinions, not my expertise. I've done some reading, I've read some different things back and forth on that, but I don't have the depth of experience or the depth of knowledge to give a strong opinion different from someone who's more knowledgeable about them. Yeah, so a quick one on that. One or two more questions. Let's see. Can chronic hives be caused by the thyroid? Trix, this is a great question. And I neglected to put that into my rant about thyroid antibodies. They can be associated with high thyroid antibodies. So hives, chronic urticaria can be as well. Now, it's not clear that they're caused by too much or too little thyroid hormone, but they're definitely associated with the presence of thyroid antibodies. So they can definitely relate. One more thing related to a question that might be useful for some people. Kathy, just talking about Kathy had the question before about smoking. I talked about coffee and caffeine. Yes, coffee in the morning, I'll be mindful of intake, maybe switch to decaf, more of a habit. So you weren't asking this, Cynthia, but I do want to mention this because it's an important thing. Many struggle with their thyroid levels being too low, with not being stable, with being erratic. We had a gal earlier who was on 88 for quite a while for Lebothyroxine. Suddenly it was not enough. So coffee can do that for people, even if it didn't before. This is kind of bizarre, but almost anything you take, like with your thyroid pill. So imagine that, I don't know, imagine here's my thyroid pill and I swallowed it. So anything I take now in the next couple minutes could screw it up. And I mean, pretty much anything besides water could screw up how I absorb it. But there are some things that can screw it up even more than an hour later. Generally, we say, wait an hour, go about your business, have your other food, it's all okay. But if someone can't get things steady, there are some things that can mess it up even more than an hour delayed. Coffee is one of them, sadly. So it doesn't affect everyone in this way. But if you are someone to where now your thyroid is off, or the amount you're taking is probably more than you would think, or it's changing in some way, or it's erratic, the coffee can be a factor. So the workarounds for that, and it's not even a decaf caffeine issue in this context. The workarounds are skipping the coffee. It's not a factor with tea. The other one is taking your thyroid at nighttime instead of in the morning, and then having your coffee in the morning as well. That can work for some. The other workaround, there's actually a study on liquid brand Terracent thyroid showing that it wasn't a problem even 15 minutes before coffee, or even 15 minutes before food. So if you struggle with absorption, they're not paying me to tell you this, but there have been good studies showing that liquid Terracent can be well absorbed even right before food or coffee. So you have coffee's a consideration and your thyroid's off. Those things can be factors. It can be worth thinking about. All right. I wish you were my doctor. I had a functional doctor, but he doesn't prescribe. Yeah, Jerry, your other option, I'm going to drop this back in, is I can act as a consultant. I do this not on a set schedule, but I enjoy these, and I do have these open, a few open in the coming months. So you can look at thyroidopinion.com. I don't act as a prescriber because I don't work with people just in one area. I'm not in a regular practice right now, which you really need to be a prescriber. But I can be happy to talk with someone and give them guidance, give them feedback that their prescriber can then help them implement. So there's that. Kathy, is there the gel thingy or is there a liquid Terracent? Yes, so Terracent, one of the studies I mentioned was based upon how they make it in the gel caps. The other one was on liquid. They make little liquid vials. This is just eye drops, but not like this, but kind of like this, like small little plastic vials that have one dose. You pop it open and you wash it down, and it's water, thyroid hormone. That's it. And the absorption is phenomenal. And there's good data showing that those who struggle with absorption, they do fine when it's a pure liquid isolate like that. They do make compounded liquid thyroid, but there was a big study done on that and it didn't come out so well. The quality control it wasn't just a matter of how well it was compounded, it was also how stable it was. And it didn't stay stable more than about a week or so. So not recommended, but the liquid Terracent can be a good fit. All right. Yes, you're a thinker for sure and a great communicator. Thank you so much for that. Thank you for your support of all of us. Thank you for being here week after week to share information and knowledge. For one, I'm grateful. You guys, thank you so much for the kind feedback. I appreciate that. And next week, anything different next week? I'm pretty sure I'm on the road next week. So let's think about 2 weeks out. And in the meantime, put your questions up. I'll still be here looking at social media and doing what I can to jump in and give quick questions and answers. But I always love to go deeper on these lives. And yeah, I can give quick comments, but I love to talk in great depth. That's where we all learn things the most. And it's fun to connect and hang out anyway. So looking like 2 weeks out, and I'll be back here. In the meantime, take great care, and I'll see you guys real soon. Bye-bye.